Good evening and welcome to Over the Counter, a half-hour show that focuses on health. My name is Monique Hammond, I'm a pharmacist, and tonight we'll talk for a little bit about vitamins. We'll first talk about vitamins in general, and then we shall pay particular attention to those vitamins that are said to have antioxidant properties. And these would be vitamin A and beta-carotene, vitamin C and vitamin E. Now, whenever the discussion comes to vitamins, it is very different and very interesting actually to study people's reaction. First of all, there are those vitamin fanatics out there who almost seem to believe that medical schools could be closed for all practical purposes because if we just all took our vitamins, we would be living happily ever after. And then there are those folks who totally lose their sense of humor whenever the vitamin issue comes up. And I consider losing one's sense of humor a total crisis. So tonight, we shall be discussing vitamins and the controversy and so forth with a cool head, and believe me, I am not here to inflame the tempers. Would it be doing any good anyway if we said that happy, healthy people who eat a well-balanced diet every day, that they really do not need all those vitamin supplements? No, it would not. That's probably what our mother told us and what we learned in school, but vitamins nowadays have taken off into a totally different direction. Multiple vitamin sales are up, and multiple vitamins are a favorite among the American public. So what exactly is a vitamin? A vitamin is a substance that is necessary for the body's normal function. Vitamins are not manufactured by the body and have to be furnished to the body from the outside through diet or through supplements. Vitamins are important go-betweens or facilitators in all of the chemical reactions that are continuously going on in the body. Without vitamins, the body would die because the chemical factory that we call the body would be shut down. So let's suppose for a moment now that we have all those happy, healthy individuals out there who do not really need any supplementation because they eat that well-balanced diet every day. If they don't need any supplementation, then who would? Well, there are various categories that come to mind. First of all, people who are on a low-calorie diet or on unusual diets, such as strict weight-reducing diets, and here we have to be careful because diet is not the last word in weight reduction. And then also we might be thinking about our teenagers here, who are mostly on diets of potato chips and ho-hos. Then we have people who have eating disorders such as anorexia and bulimia. People with extra requirements because they are recovering or suffering from a severe illness. People with alcoholism. Now here we often look at cases of vitamin deficiency because of poor nutritional habits, but we must also remember that people suffering from alcoholism often have liver damage to some extent. And so we have to be very careful what kind of multivitamin or what kind of vitamin supplements we pick for these people, and also what kind of minerals for that matter. Because these people can get pretty toxic pretty quickly, and so ask for help if you are choosing a supplement for or product for a patient who is suffering from alcoholism. Because we need to be especially careful with vitamin A and also with beta-carotene. People with digestive problems, such as malabsorption syndromes. And then we have pregnant women and breastfeeding mothers. And again here, we do not medicate ourselves with anything while we are pregnant or breastfeeding without consulting the doctor. Because this is very important, and we are going to be talking a little bit more about pregnancy and vitamin A in a little bit later. But suffice it to say that people who are pregnant and who are breastfeeding should not be taking any medication that is not particularly prescribed for them. Children. Now here we have to follow the advice of our pediatrician, because when it comes to children, we have to be careful with vitamins and minerals. Don't guess at any doses for your kids, because children are not small adults. And don't make them sick with vitamin overdoses while you're trying to keep them healthy. Now, vitamin D is often given to children by parents who try to strengthen the children's bones. However, indiscriminate use of vitamin D can be dangerous. So check it out first, because sometimes we deal with a very fine line between what is acceptable and what might be excessive. Now, some medications can also cause vitamin deficiencies. For instance, people who are on anticonvulsants or anti-seizure medications for a long period of time might need some extra vitamin D supplementation somewhere down the line. And a small percentage of those patients also might be needing some extra folic acid. But of course, anybody undergoing medical treatment of any kind, no matter what the diagnosis, should always check with the doctor before medicating him or herself with any other product, and that does include vitamins. Always check it out first and never take any chances. Some disease states result from vitamin deficiency and respond miraculously to appropriate vitamin supplementation. And here, of course, you might be thinking of pernicious anemia, which is due to a lack of vitamin B12. And if caught in time, the patient is going to make a mind-boggling recovery from vitamin B12 supplements. And then, of course, we all know about vitamin C deficiency and the problems of scurvy. Sailors on the old schooners would have bleeding gums and lose their teeth because they had a lack of fresh vegetables and fresh fruits. And so when they embarked on month-long voyages, oftentimes they came down with a big, heavy case of scurvy. Now, scurvy is by no means a disease of the past. And it is still seen in patients that have poor nutritional habits, and it has been reported that among college students, sometimes mild cases of scurvy are still found. Again, probably too many candy bars and too many potato chips and not much else. So again, our bodies need adequate amounts of vitamins to survive and to function normally. Now, if it is true that normal doses of vitamins used by overall happy and healthy people do not usually cause us any harm, then it does not necessarily follow that much, much larger doses even are better. Now, since vitamins are classified as nutrients instead of drugs, we often can only rely on testimonials from believers that actually miracles are happening under the influence of very, very large doses of vitamins. Since vitamins are not classified as drugs, we do not really need to look towards the government or towards the FDA in order to protect us in this case. Food regulations are much less stringent than drug regulations are. The FDA, of course, can pull products off the market if there are some unproven medical claims that are made on the label. And the FDA can also interfere in case that a product is causing some undue toxicity, but otherwise we are on our own and responsible for our own safety. Information on the effect of megadose vitamins is usually obtained, first of all, from those who sell them, from word-of-mouth advertising, from consumer-oriented magazines such as health and nutritional magazines, from specially organized lectures and seminars, and from TV commercials, because you guessed it, vitamin sales translate into big, big dollars. Now, during the 3-month sales period that ended February 28, 1993, and so if my math is correct, that sales period started then in December of 1992. Anyway, during those 3 months, multivitamin sales topped $82.9 million. That's multivitamins alone. And these figures are also only from sales in supermarkets and in drugstores, because there we have the best statistics. Now, it can be argued then that megadoses, or I should also qualify this, a megadose is actually a dose that is 10 times or more the recommended daily allowance. Now, it can be argued so that megadoses of vitamins can no longer be defended as being supplement or replacement doses. We are now using vitamins actually as drugs, and the trouble with megadoses is that they do not stretch only the limits of our wallets, because these things are expensive if you have ever priced them, but we also enter into the toxic ranges of vitamin dosing. Now, many of the miraculous properties of some vitamins are actually due to the fact that they have antioxidant properties or characteristics. And this is true for vitamin A or beta-carotene, vitamin C and vitamin E. And these vitamins are not only facilitators in chemical reactions in the body, but they are also gobblers of the free radicals. Antioxidant doses, however, are usually found in the so-called megadose range. Now, the expression free radical is, of course, a new buzzword in medicine because it spells doom, since free radicals are accused of doing so many nasty things to our body. Bad cholesterol, for instance, that is also known as LDL, is oxidized by these free radicals, it seems, and that has something to do with the formation of artery clogging plaque that somewhere down the line then leads us to have heart attacks. And the oxidizing free radicals also appear to create some of the damage that underlies the development of cancer. Now, in lay magazines, as well as in the professional literature, we are being deluged with ads such as these dealing with the benefits of antioxidant vitamins. And then we have these little numbers that really catch our attention. They look like articles and they read like articles. Actually, they are called health messages, and they come to you free of charge from your friendly drug manufacturer. And these two in particular, if you couldn't read it because the print is too small, anyway, these two deal with the merits and the importance of beta-carotene. This ad quite graphically explains to us that the same reactions that turn the apple brown when exposed to the air and that make a car rust also raise havoc in our bodies. The problem, oxidation reactions, and the proposed fix, antioxidant vitamins, of course. Now, when it comes to antioxidant properties, then never underestimate the merits of a broccoli. And of course, this message did not get very far in the White House under then President Bush, but it is the truth that cruciferous vegetables such as mustard greens, broccoli, cabbage, Brussels sprouts, and so forth have antioxidant properties of their own. So when you think about antioxidants, also think of the merits of the fruits and the veggies too. And now let's talk for a little while about vitamin A. Vitamin A is only found in animal tissues. Remember the old cod liver oil? Well, it was full of vitamin A and D. Now, vitamin A has been discussed extensively lately because of claims that it helps in preventing cancer. And it is true that low levels of vitamin A in lung tissue and lung cancer seem to be in some way connected. Also, some animal models have shown that exposure to particles or chemicals in smoke seem to be lowering the vitamin A levels in lung tissue, and this could be one of the reasons why secondhand smoke is as dangerous basically as smoking itself, because the particles in the smoke do lower that vitamin A level in the lung tissue. And this would make sense, especially if it is proven that vitamin A indeed has a protective effect when it comes to lung cancer in particular. Of course, reports such as these make vitamin A sales soar, because people reason that if a little bit is good, then much, much higher doses have to be a lot better, and we do not want to take any chances in coming down with anything as nasty as a lung cancer. But there is a hitch to that, and we'll talk about that. Vitamin A has also been discussed as a possible protectant against heart disease, and this is again because it has all those antioxidant properties. But there are some problems with vitamin A. Vitamin A is dissolved and trapped in the body fat. And when one takes daily megadoses of the stuff, then someplace down the line we might be looking at a toxic situation. Now, since many of the symptoms of vitamin A overdose come on very slowly, it is often difficult to diagnose this. And so when the doctor asks the patient, well, what have you been doing different lately that might be making you sick? And the patient answers, well, nothing really, because the patient also does not connect that the vitamin might be what makes the patient ill. And so it's exactly, however, the accumulation of the vitamin over time that can make us sick. Sometimes the symptoms are mistaken for other problems, and the possibility of a vitamin overdose is not even considered. Because many people, when it comes to vitamins, do not tell their doctor in the first place that they are taking them. And oftentimes, if patients are taking megadoses of vitamins, yes, they do lie about the dose. Now, some of the long-term vitamin A overdose symptoms are, and they are not necessarily in this order, but people complain sometimes of arthritis-like bone pain, headaches, hair loss, nosebleeds, dry peeling skin, and cracked lips are reported frequently. And also liver damage can happen, and this can be permanent. And this is to only name a few. Now, in order to curb the toxic effects of vitamin A, beta-carotene has gained a lot of favor lately in supplements. Beta-carotene is contained in green and yellow vegetables. It is actually called a precursor to vitamin A. It is called a provitamin. It is not active until it is activated in the body. Usually it happens to mostly in the small intestine, to a small extent in the liver. But anyway, beta-carotene is not active until it has been activated in the body and transformed into vitamin A proper. Beta-carotene is generally well tolerated, but it is not as well absorbed as vitamin A. It might discolor the soles of the feet and the palms of the hand a yellow color, but an overdose situation rarely arises because the activation of the provitamin beta-carotene into actual vitamin A seems to be sort of an on-demand thing by the body. But so, if beta-carotene seems to be safer than vitamin A proper, there are also some new studies that seem to suggest that in some situations beta-carotene does not work as well as vitamin A itself does. And an example for that is the treatment of retinitis pigmentosa. Now, Harvard Medical School had done research on this, and they had published their results saying that vitamin A has been studied in the treatment of retinitis pigmentosa, which is a degenerative disease of the eyes, and it is an inherited disease. Right now there is no cure, and worldwide about 1.5 million people seem to be suffering from this condition. Anyway, the Harvard people found that vitamin A seems to be slowing the progression of the disease, but beta-carotene does not seem to be producing the same reliable and predictable results. And there is something else that came out of this study, and this is, and I'm quoting, the same study also showed that large supplemental doses of vitamin E, now we're talking E, not A anymore, E. Large doses of vitamin E actually accelerated retinitis pigmentosa. And so at one point in time it was believed that vitamin E also was beneficial in this treatment. So this brings out an important fact, and that is, before we go and medicate ourselves with large doses of vitamins or with any other kind of products, that we should be checking out the latest facts. Especially for the vitamin situation here, the research is ongoing. There are just about daily new reports of what has come out. And so before you go and medicate yourself, especially responding to some paper to some article in a paper or to some medication reports that were published on a talk show or so forth, always ask what the latest is. Now, as I mentioned before, pregnant women have to be very careful when it comes to vitamin A supplementation. You should never take any more vitamin A than what is prescribed for your doctor or what you find in the supplements that are being prescribed for you. Because vitamin A has a tendency to cause birth defects if it is used in excessive amounts during pregnancy. So do not medicate yourself with anything else, again, that your doctor has not specifically prescribed for you, because you only have one time to get it right when it comes to pregnancy. Now, you might have read some reports lately, or you might have heard about some reports that are dealing with the usage of folic acid in pregnancy. And indeed, there are some people out there who believe that pregnant women should be judiciously medicated with folic acid because it seems to decrease the incidence of certain birth defects. Now, before we get again creative with medicines in pregnancy, please check it out with your physician and see what he or she thinks about the folic acid issue in pregnancy. Do not overreact and do not take matters in your own hands. Once more, be cautious and get the facts straight. Vitamin C is another vitamin that has been discussed for years. Does it prevent the common cold? No, but it seems to help soften the blow. Because taking extra vitamin C when we are actually suffering from a cold seems to be helping us to get better faster. And it does this not because it is a vitamin, but again because it is an antioxidant, and it helps to neutralize the free radicals that cause tissue damage, the free radicals that are released in response to the viral invasion of the body. Also, a UCLA study has shown that vitamin C can protect us again from heart disease. Again, because it is an antioxidant. Now, apparently, men who took between 300 and 400 milligrams of vitamin C per day had 45% fewer deaths from heart disease and seemed to be living an average of 6 years longer than those people, those men, I should specify, who took only 50 milligrams of vitamin C per day. And of course, when headlines such as these hit the media, then people go nuts. They rate the vitamin sections without giving it a second thought, without asking questions, without checking dosage recommendations, without checking, as we talked about before, whether the vitamins even are indicated in their condition. They don't seem to be worrying about drug interactions. And this is one of the important things, because consumer indiscretion is probably the spookiest aspect of the vitamin craze and controversy. People do not think when it comes to vitamins. They lose their common sense. Now, vitamin E is another vitamin that is supposed to have some special kinds of powers. Vitamin E has been proposed as protecting against aging, heart disease, baldness, ulcers, warts, PMS, you name it. Someplace in the literature you can find probably an article that supports the theory that vitamin E can do all of this and much, much more. Now, vitamin E seems to be relatively well tolerated even at high dosages. However, check it out first, especially if you're suffering from certain bleeding disorders or if you're being treated with the blood thinner Coumadin, because high doses of vitamin E can make us bleed easier and faster. But the latest reports regarding vitamin E have been that it protects against heart disease, and again because it is an antioxidant. Remember that vitamin E helps to keep bad cholesterol or LDL from being oxidized so that the artery clogging plaque is not formed or not formed as fast, and so that way it seems to be protecting us against heart disease. But researchers are still looking into this matter, of course, and there will be a lot more news on this in the future. Now, the free radical theory has also been discussed in relationship to Parkinson's disease. But last January, the New England Journal of Medicine reported that patients that were included in a large study that was trying to probe the beneficial effects of the free radical gobbler vitamin E did actually not receive any observable benefit from taking the vitamin. However, if you do suffer from Parkinson's disease and if your doctor has prescribed some vitamin E for you, then by all means, follow the instructions that your doctor has given you exactly. Do not stop taking the vitamin E or any other medication that is prescribed for you without discussing it with your doctor first. Remember that the final word is not out on any of these antioxidant theories. There is more research going on and material is being published daily. So do not change anything that your doctor has prescribed for you. Discuss it always first. Neurologists also use very often vitamin A, C, and E, and beta-carotene in people who have suffered a stroke. And again, we try to neutralize some of the free radicals that could cause further tissue damage. And of course, again, researchers are working extensively on these theories because there definitely seems to be some merit to the theory that there is a benefit to the antioxidant properties of vitamin A, beta-carotene, vitamin C, and vitamin E. But in the meantime, let's remember that vitamins are chemicals, that they can cause drug interactions, that they are not maybe indicated in any condition, and that we also have to be careful and that we should consult a doctor or at least check out the facts before we medicate ourselves with vitamins to the max. Many doctors are worried that with all the vitamin crazes out there, that people might be substituting vitamins galore for decent health habits and for common sense for that matter. The danger lies in the fact that we might be saying, now I can smoke all I want and I can eat all the fat I crave because I'm stuffing myself full of those free radical gobblers. We all wish it were that simple. It is not always enough to look on the shelves of the drugstores or of the health food stores for some kind of easy answers that do not require a lot of effort. And maybe a few bucks will not be keeping us off the hook in this case. Vitamins are big business. And this is illustrated by the fact that one of the major drug companies is planning to build, or is building as we are speaking, a brand new factory that would be able to produce 350 tons of beta-carotene per year. Now, 350 tons of the stuff ought to keep America antioxidized or deoxidized or whatever for quite some time. And of course, the manufacturers also expect our fears and phobias to pay off big time. But I'd like to also share an result of a little survey that appeared in a professional magazine where they asked people, why do you take vitamins? And 83% of the people who responded said that they did so to improve their health. And this, of course, is probably the more positive aspect of the vitamin usage, if I may add a little philosophical thought here, because it tells me that indeed we realize that there are some things about our health that we could improve. We try to use vitamins to prevent disease. And whether vitamins are the solution to our problems, or whether a change in lifestyle might be more appropriate and more productive, that again will be debated for decades. I am encouraged that the thought of prevention seems to be coming through in this whole vitamin controversy. Because it is scary to think that people might be using vitamins instead of common sense. And this again brings us to the end of our show. I thank you again for watching, and I hope that I'll see you next time. But before I leave you, I'd like to remind you of something. At the end of the show now here, I'm going to give you again my mailing address, which is Box 6495 here in Minneapolis. And it's always nice to have you say hello, but I also need to have your feedback, because the reason why I do this show is to get some kind of a communication going between myself and the community when it comes to our health. And I can only know what the desires and what the interests are of the community when it comes to our health, if you let me know. So if you have any particular topic that you'd like discussed, or a guest that you might think might be beneficial for all of us to hear from, then please let me know. Write to me, because that's the only way I can find out. And I thank you very much. And until next time, stay safe, stay healthy, and I'll see you. Good night.